If you left dental school and you thought, you know what, I'm ready, I'm just going to waltz into practice and I'm just going to crack on and be a star, that would worry me more. Your anxieties are totally reasonable, but they're not novel. They're not something that's happening now in the 2020s. They've happened 50, 60 years. You're not got the skills to suddenly, jump off a cliff and fly. You're the little baby bird who's learning to fly. You've all decided to go into healthcare, and swear the Hippocratic Oath to look after patients. That's what you're primarily here for. If you want to make big bucks, you should have gone into banking or into the city, right? The professional world you guys are growing up in, it's the clinical excellence, sure. Obviously, you're going to have to practice, you'll do courses and so on and so forth, and you keep learning till the day you retire. Dentistry is not a solitary profession, especially nowadays. You work with so many different people. If you had a surgeon operating on your mother, father, brother, sister, or yourself who had a gung-ho attitude, like, I've just graduated, I'm cool, I know everything, and I've been on this course, I just know it all. Would you be inspired by that? Probably not. Shoot for things, go for things, 100% go for things. Be prepared not to always get them. If you don't quite get it, learn from it.
Now, today we're joined by a titan in dentistry, a highly accomplished dentist and scientist by the name of Professor Avijit Banerjee, the godfather of minimally invasive dentistry. With an unmatched list of accolades and achievements, including the John Tomes Medal and the William H. Bowen Caries Research Distinguished Scientist Award, Professor Banerjee has dedicated his life to scientific research and clinical impact. Currently the Professor of Cariology and Operative Dentistry at King's College London, he's authored over 175 peer-reviewed papers, 5 internationally acclaimed textbooks, and is the editor-in-chief of the BDJ portfolio. If academic excellence was a person, it would be the Prof. Now today we discuss his own student journey, how dentistry has changed and how it hasn't in the last 3 decades, and his advice for young dentists from years of mentoring students through their journey to competency. Finally, we touch on minimally invasive dentistry, what it is, why it's important, and the Prof's most recent curriculum textbook, A Clinical Guide to Advanced Minimum Intervention Restorative Dentistry, the successor to the acclaimed Pickard's Guide. A goldmine of value, not one to miss.
Welcome back to The Young Dentist. I'm Afif.
And I'm Fahim.
And today we had the absolute privilege of being joined by Professor Banerjee, author of this incredible book, which we'll get into later on. But let's start things by asking you, how are you doing today, Professor Banerjee?
I'm very well, thank you. And thanks for inviting me. It's an absolute pleasure to be here.
Thank you to host you.
Of course.
Okay. So, Professor, who are you? For anyone who doesn't know, who are you? Give us a bit of a background.
So I'm a professor of Cariology and Operative Dentistry at King's College. I've been working there for probably a bit too long. I started there as a student, like yourselves, in 1988, so you can do some maths and work that one out. And I did my PhD and my clinical training there as well. And currently I am an honorary consultant advisor to the Chief Dental Officer, which is the Office of the Chief Dental Officer in England. I'm the President-elect of the British Society of Oral and Dental Research. I lead the Oral and Dental Specialty in South London for the NIHR Research Development Network. And I'm Editor-in-Chief of the British Dental Journal portfolio as well. Just a few things in my spare time, absolutely.
What a list of accolades. So, Professor, maybe a better question to ask is, why do you do what you do? What really motivates you?
Well, it's a great question. It's a classic interview question from the 1980s when you went to dental school. Why do you want to be a dentist? My family were all medics. I wanted genuinely to do something with my hands and help people pretty much immediately rather than doing consultations and prescribing medicines. And over the years, I think hopefully I've done that with the patients I've looked after. And then obviously whilst I was at dental school, I realised there was that other options of teaching and doing research and everything else. So I've been very fortunate. I worked with some amazing colleagues over the years, and, things don't happen to you without a little bit of luck, but I do believe that, and you have to make your luck in life. And I think I have. And so, yeah, I'm here where I am now, writing textbooks, teaching you guys and having fun.
You mentioned making luck. What does that look like?
So I think making luck, it's an interesting point because, again, I'm obviously a little bit older than you guys and grew up in a different generation. And I think it's about working hard. It's about being present, pushing yourself out of the comfort zone a little bit sometimes, not panicking when you make errors. Okay, people are allowed to make mistakes and you learn from those things. And if you keep doing that and always there, just sort of quietly chipping away, It's not always glamorous, it's the hard work that goes on sort of behind the scenes. And if you keep doing that and keep doing that and keep doing that, what you suddenly find is opportunities arise, or suddenly people talk about you, or a position comes up or something comes up. It's not always financial or something with a tangible reward. It's a reward in here as much as it is a reward in your pocket or in anything else. So I'm a firm believer in that, and I brought my kids up that way as well.
So it's almost showing up consistently is the key thing you need to do.
Yeah, showing up, but when I mean showing up, I don't mean just physically, I mean mentally. Yeah, so the physical bit, that's fine. You, as a student, you need to turn up to things. I mean, it's shock horror. But actually, it's about being aware that it's not just what your teachers say. There's a huge amount more. And what you are being told is just the tip of the iceberg. And I'm sure we'll talk about sort of credibility of information a bit later on. And you guys have that challenge, which I didn't have when I was growing up. So I listened to my teachers and my tutors and read the textbooks and the papers, because that was my source of information. But you do it not just sort of what you're told or the minimum amount, but you do extra. You run the extra mile. And that's when your luck is made. If you do the bare minimum, that's why it's called the bare minimum.
Yeah. And having seen so many students pass through dental school and go on to become excellent clinicians, I mean, I'm guessing you would have seen that in action as well.
Mm-hmm. Yeah, absolutely. And you've the world you guys are growing up in, the professional world you guys are growing up in, it's the clinical excellence. Sure, obviously you're going to have to practice. You'll do courses and so on and so forth, and you keep learning till the day you retire. And don't forget that. It's not like, oh, I've done a course on this and I've done 2 years doing this, therefore I'm an expert. No, you're not. All right. You never become an expert. You keep learning, keep learning, keep learning. So there's that side, but there's also the emotional side, the leadership side, the social side, everything else, where you also make opportunities and learn. And the rounded clinician is the one who does all of those things equally, in my opinion, having watched it for 30 odd years. Clinical is obviously critically important, obviously, but your communication skills, getting inside the patient's head, having empathy with them, and with your team, because you're going to be working with other people. Dentistry is not a solitary profession, especially nowadays. You work with so many different people. If you then branch out into teaching or research, that brings in other layers, of interest in different things. So the beauty you guys have now at all the dental schools in the country, we teach you so much more than just clinical. And people forget that sometimes because it's not always totally measurable. All right. And these are things that you pick up and you learn and you keep doing and keep trying, make mistakes, succeed, learn, and so on. So that to me is making your luck and making your way in life.
Mm-hmm. Awesome. So, Professor, you asked us a question out in the balcony beforehand. Could you like to repeat that so the audience can understand what it is, and we'll try and give our perspective on that?
So we were doing in our little briefing session. One of your existences in being in your group is to sort of, you mentioned, to bridge the gap. I think you used that phrase, to bridge the gap between sort of university and real life, I think was the phrase. And one of the things I wanted to ask you guys, because I'm too old now, all right, you're the future, and people listening are the future. What do you perceive are the gaps? Because maybe we can have a conversation about that. Yeah. So, yeah.
Yeah, I think one of the things that comes up a lot, and having spoken to a lot of our other guests who have mentored actually young dentists who've graduated, a lot of it is simply the application of what you learn at dental school. That's one part of it, as in terms of we're taught to be a safe practitioner, and actually applying that to the furthest extent that we can. And also realizing that dentistry, as you said, was more than simply your clinical skills. You're not treating an isolated tooth. We just had a guest recently who talked about you have to consider the patient as a whole. I think that's one thing that's lacking as well. And exactly as you said, which is that the skills that also we might not be taught in dental school or now, which are being taught a bit more, which are more of the, the people skills, the communication skills, the skills that you might not consider. And that's the third point that I want to pick up on, is that there's a lot of skills out there that, I mean, my cohort, for example, don't even realize are associated with dentistry. For example, running a business if you're practice, right?
Or there's always on the back of that, if you're self-employed, you also have to understand business at that point, right? So that's another thing.
So perfect, and that's really valuable to hear. And I'm not disagreeing with anything you've said, because these are clearly things that young students and then graduates have to deal with. 100%. What's intriguing is that when I was your age, we had the same concerns. They're not new. All right, that's the first thing. So in many ways, I want to reassure you. All right, they're not new. And one of the big perceived problems, and I see it with my students and other teachers at other schools will see it, that doesn't matter which school you go to, you're all the same beast, all right? It's confidence. Okay, that's the word. So actually, you are taught clinical skills. You are taught communication skills. I accept business side, perhaps, depending on where you work and everything else, there's perhaps slightly less so in that. I fully admit that. But in terms of looking after patients, we do, all the dental schools in the UK and abroad will all furnish you with the skills you require to at least start off. Now, that's the point. You're not got the skills to suddenly, jump off a cliff and fly. All right? You're the little baby bird who's learning to fly. Yeah? So, and you've got to start somewhere. And a dental school cannot equip in 4.5, 5 years a student with every possible bit of knowledge, and that's physically impossible for any course, nothing to do with just dentistry. So one of the things I see is that students, really good students I teach, by the time they come up to finals and getting close to that pointy end of the course, suddenly the confidence starts to drop. Can I do this? I've got to take that leap after qualifying. Am I ready? Okay. I promise you, I felt the same. All my colleagues felt the same. All your senior professors felt the same when they graduated. It's natural. All right. I would argue, compared to when myself and my colleagues graduated, we didn't have any safety, or we had very few safety nets. You found a practice. You hoped you got on well with your principal, who ran the practice. And you learned, and you cracked on, and you did it. There weren't really courses and things like this. As I was graduating, vocational training came in, so they started to formalize this step between university and practice. So there's that bit in the middle, so to hold your hand a bit more, which is 100% right thing to do. And then that's evolved over the years, and because what we teach and how we teach it has changed. Through no one's fault, that's evolution. The role, that middle ground role of vocational training, DCT training, etc., becomes even more important now. Okay, so what I want to do is reassure you all that your thoughts, your anxieties, are totally reasonable, but they're not novel. They're not something that's happening now in the 2020s. They've happened 50, 60 years, obviously with slightly different colouring, but yeah. So that's meant to be reassuring that it's not worse now or you've got to panic. And this goes back to my thing about being present. If you're at school and you pitch up to everything and you do everything, all right, that your timetable to do and you're asked to do, and you do a bit more, you will be fine. You will be absolutely fine. And then you go out into your vocational training or equivalent, and you'll learn about the business management. You'll learn about, having to see more patients in a day and juggling everything. All right. There's no way we can teach that at undergraduate level. It's physically impossible. So I think that was really useful for you to tell me what that perceived gap is, because I really want to reassure you that it's not unsurmountable. In fact, it isn't at all, and it's natural. If you left dental school and you thought, you know what, I'm ready, I'm just going to waltz into practice and I'm just going to crack on and be a star, that would worry me more. That would worry me more, because you guys, all of you, by the very nature of going into healthcare, means you're careful, you're methodological, you should be a little bit self-deprecating, thinking, am I doing it quite right? Am I doing it to the best? You should be your own worst critic. Correct. Spot on. And if you think about it, if you had a surgeon operating on your mother, father, brother, sister, or yourself, who had a gung-ho attitude, like, oh, I've just graduated, I'm cool, I know everything, and I've been on this course, I just know it all, would you be inspired by that? Probably not. But the one who's worked through, got experience, has seen several cases or done several cases, been on, has reviewed them, is open with the outcomes and everything else, those are the people you admire.
So, Professor, what do you think about ego then? You kind of mentioned that, people having a conflicted sense of ego. What's your perspective on that? Is that something you see in dentistry often?
We've seen it since dentistry was born. All right, human beings are human beings, and it's interesting with students and young qualified clinicians. Often, it's it's a generalized statement. I accept. I'm not saying this applies to every single person, but generally speaking, the people when you're more junior, the more confident you are, or the more overtly confident you are, i.e. ego, you use the word, for me, that just rings an alarm bell early on. Now, again, you're somebody, you've all decided to go into healthcare, and swear the Hippocratic Oath to look after patients. That's what you're primarily here for. If you want to make big bucks, you should have gone into banking or into the city, right? Let's cut to the chase here. You've chosen a really admirable profession where you'll be able to do a lot of different things. You've got a bit of flexibility, so that's why it's so cool. But to get ahead of yourselves, and I don't mean just young dentists, that happens to older ones as well. If you sort of jump on a bandwagon and think, right, boom, in 6 months I can do something, and that's it, I'm fabulous. That is essentially a sign of ego. I'm not sure that's right. But I don't want people to think I'm saying, oh, therefore you should be a little shrinking violet and sitting in the corner and shaking. You should have some inner confidence in your own abilities. Yeah? So there's a balance, is what I'm getting at.
You strike me as quite a realist.
Yeah, totally. That's what happens when you get grey. All right? When you get grey, you become a realist. When you have nice jet black hair like you guys, then actually you can be hopeful. I want to shoot for the stars. And there is nothing wrong with that. And you should. Because if you don't do it now at this stage of your career, when are you going to do it? Right? All I'm saying, and you're right, I am a pragmatist as I got older, because what I'm saying is shoot for things, go for things, 100% go for things. Be prepared not to always get them. I'm not going to say be prepared to fail, because that's not necessarily it. Because it's not achieving that isn't failing. It's not failure, right? So I phrased what I said very carefully. I said, you go for it. If you don't quite get it, learn from it. Learn from that experience, because none of it is failing. And I think that's important.
What would be the approach to setting the expectation there then? Would you set your expectation in order to succeed? Or is it that caveat that even if I don't succeed, then I will have learned the skills to succeed next time?
So the response to you there is, what do you mean by succeed? All right. And we can get really sort of very, sort of ethereal about all of this,
And that's the last question we ask all our guests.
Well, there you go. Well, we're cutting to the chase here, right? Look, no, but joking aside, we'll talk about it at the end. That's fine. But I think it's, the difficulty in the world you live in is that, if you like, you're expected to succeed in inverted commas, right? Whatever that means. And that's the problem. Because I would argue, if you've worked hard, and as I said, you've applied yourself, you've been president physically, mentally, etc., right? You've done all those things. You will have a core set of skills. So I think, as you mentioned, you'll be a safe beginner, safe practitioner, right? Perfect. Absolutely. That's exactly what you should be. You're not going to be perfect. You'll be nervous about some things. You may not have done a few procedures, enough of them, etc., to have the confidence. No problem. Because you won't have the ego to think, well, I've pulled 3 teeth out, therefore I'm a genius oral surgeon, and therefore I'm going to go into private practice. Because that's crazy, isn't it? If you think about it, that's crazy. But what you will have is you'll have that ability to self-reflect, which you are taught every single day at dental school. You do it every single day. You self-reflect, self-critique, and learn. And I would argue that is being successful also. So I think you guys can succeed in many, many, many things at many, many different levels. It depends how you want to measure it.
Awesome. That sounds good. So, Avi, you mentioned jumping into the specializing too early. What are your thoughts on specialising versus general practice for a newly graduated dentist?
Honestly, I know the world we live in at the moment in the UK, especially with NHS dentistry and everything else, is a bit complicated. But as a young dentist, I don't think you actually have to worry. You've got enough other things to think about. You don't have to overthink this. Worrying about those things are for people like me, right? You guys, I think you've got to be present to look after patients. You will not have the experience and the full clinical skill set to go into specialist practice. All right? Simple as that. Okay? And this idea that you can just go from graduating and doing 5 minutes in the NHS and then going off into specialist practice and think that's a really easy route. That's nonsense. It's not an easy route. So it's fraught with challenges. The beauty of actually staying in the NHS, however difficult that might be, staying in the NHS and working with a team of dental nurses, dental hygienists, dental therapists, practice managers, clinical dental technicians, orthodontic technicians, you name it, learning how a team works, learning how you really look after real patients with real disease, because that's what you signed the Hippocratic Oath for, not to do a line, bleach and bond, all right, is to actually look after people with disease and do the behavioral psychology on them and motivate them and treat them and everything else. That is actually what makes dentistry spin round every day. Yeah. Okay? All the other stuff is trappings. And it's very easy for you guys to look on social media and see all these trappings. Because they're very glitzy and glamorous, aren't they? Right? And you think, oh, I want a piece of that. You have to wonder how those people are doing that and what they're doing. Because actually the real people who are having a really good lifestyle and everything else have worked really hard and have gone through the steps. And to do specialist, training, to then get on a specialist list, to then do proper private practice should be the aim.
Got you. So you mentioned the validity of information now, we live in a world where there's so much information. How can you be sure that the information you receive is actually valid, Professor?
Yeah, okay. I had a student last summer. I was teaching on clinics. We were doing a debrief session at the end of the clinic of what everybody had learnt from their patients. And it was a more senior student actually, was talking about the fact that, there's so much information online and things you can look up, papers, podcasts, you name it, everything, right? And I smiled and said, well, actually, all you have to do is read the textbook and you'll get honours. And everybody just looked at me and said, what do you mean? I said, well, all the content you need are in the books that your teachers provide you, all right, or ask you to read, plus peppered with some extra papers, that are usually on reading lists that are given to you. All right. Those are all vetted and checked by your staff all around the country, every dental school. And pretty much every dental student in every dental school is reading the same papers because they're the key ones. Right. So the advice I would give to young dentists and graduates for that matter is take the advice of the teachers and professors who you signed up to go and be taught by. All right. They're the most important people and they're the most credible. Number one, they're the most credible. After that, of course, you've got everything on digital social media, right? But you guys know as well as I do, I don't know what the percentage is, 70, 80% of that. You've got to be so careful and interpret what what you're seeing. I'm not saying it's all bad. I'm not saying that, but you need to be very careful in your interpretation. The effort that takes, I've said to my students, well, put half the effort into just reading the textbooks and the papers and turning up and going to your seminars and having discussions with your teachers and your peers. You'll learn 10 times more.
This message has been brought to you by Colgate. Now, you already know Colgate for their toothpaste and oral care, but what you may not know them for is the massive amount of support that they provide dental professionals, helping educate and empower the next generation of dentists to boost their career. Now, as dentists, we all know the importance of CPD in developing clinically. The recently launched Professional Education Hub by Colgate is a centralized platform and one-stop shop for all things verifiable ECPD related, filled with bite-sized videos, webinars, articles, and more. From leading clinicians, you can develop your career and obtain verifiable ECPD from the comfort of your screen. The amount of value is insane. With an ever-expanding catalogue of content to choose from, there's something for everyone. Visit www.colgateprofessional.co.uk to sign up and register now. And now, back to the episode. I think there's one point there, and I'll give you a bit of an insight as well. It's similar to seeing that gap before. It's the ease of access to, especially with AI, and I've seen this firsthand. That when you're trying to do research for an essay or some sort of assignment in university, it's so easy to insert a prompt into AI and it'll pump out an explanation, but also the accuracy of that is questionable. But that is almost drawing students away now from actually physically opening a textbook and reading through it.
I know. And the danger then is you've got to remember then from our perspective as teachers at university, we have to think of cleverer ways of assessing you. So if a student in inverted commas is doing what you're saying, which clearly people are, then we will assess you in such a way that if you have just followed your AI, your chat GPT or whatever search engine, to find out your information, unless you really understand that information, you'll still struggle. So ultimately, what you've got to think of this is that these are just ways of absorbing information, right? So when I was your age, we had libraries, we had books, and we had journals. That was it. I mean, that was literally it. There was nothing else. Right? And obviously your teachers and lectures and seminars, right? So you had to go to a library, you had to get a book, you had to read it, you made your own notes, you'd photocopy pages from a journal and you'd have, and that's what you learned. We didn't have all access to anything. Now you have access to amazing amounts of information, some of which is unbelievable in terms of the quality and clarity of content and everything else. But interspersed with that is a whole load of dross. So to me, where time is of the essence, you don't have, inordinate amount of time to study this. So that's why I suggest all students first primarily is look at the books and the papers and the information that your university, your departments, your teachers are delivering to you. That should be number one. 100% number one, yeah? And if you get all of that and then have your discussions in seminars and tutorials, etc., you will have probably 75, 80%, maybe more of the information you need. And in some areas, even more, as I said, right? Then, by all means, sprinkle it on with the stuff you're talking about. But then you're ready to use AI. You're ready to use social media because you are already armed with knowledge. If you don't have that knowledge in the first place, then you can't start to distinguish what's right and wrong out in the big world.
Gotcha. So before we go into the preventative care and all that side of things, I'd like to ask a question you asked us back to you then, Professor Avi. Based on all that knowledge so far, what would you say are the most underserved parts of the curriculum today?
Gosh, I suppose because of logistics and everything else, that the way dental schools and universities work with hospitals, I suppose the most underserved thing now is probably the amount of clinical experience. All right, I don't think everybody's going to say that, and I think it's probably true. All right, I think we'd be lying if we said otherwise. Okay, you've got to remember that's not laziness from the dental school side or anything like this. We live in a very different world to when I was at your stage. So when you're a second year, when I was end of second year, I'd already treated, 30, 40 patients. I'd already, in those days, we had quotas. We had to sort of tot up the procedures we'd done. And I remember I'd done 40 amalgams, 30 composites. All right. And by end of second year.
For reference, we're starting patients possibly end of this year or start of next.
There you go. And I'm not saying what I did was right or is better. That's not what I'm saying. It was different. But the world is different. Dentistry was different. What patients wanted was different. The way hospitals work were different. The way universities work were different, so on and so forth. Now, as you guys well know, there's huge amounts of process and regulation in everything, right? And hospitals suffer from that, universities, etc., coupled with the fact you guys have different needs and expectations as students, and so do your patients. So you add all that mix in, suddenly it's not that simple anymore. When I was growing up, I was literally just having lunch with a classmate yesterday and the sort of family friends, and we were talking about exactly this, and that, I would see my patients, he would see his patients. We wouldn't be looking at each other comparing all the time because we knew one week I might have hit gold and done loads of treatment and he might not have done very much and vice versa. But we didn't panic about it because we knew in the end everything sort of evens out. And it still does now. It still does now. But the problem is everybody panics a bit more, like we were talking about earlier. All right. If you are just present and you do, rather than worry about and analyze, you actually get on with it and do it. Turn up. If your patient's not there, help others out. Stand with your tutors, your clinical teachers, and go around with them and actually learn. I appreciate it's not the same as actually physically treating a patient, but it's a pretty decent second best. And if you keep doing that, guess what? As the weeks go by, everything evens out. So you will get the clinical experience, but I accept it's not perhaps as great as in quantity as it was.
Is there anything you think dental students can do or be more proactive with in interacting with their tutors or getting the most from the curriculum that they might not be doing right now?
I think, obviously I'm biased because I'm one of your teachers, sort of thing. Obviously I'm going to say it from my perspective, but I'm going to say it's very easy to see the negative side of everything, right? When things don't work. Yeah. It's human nature. That's not a criticism. Totally makes sense. I would argue you've also got to remember that the people teaching you are there basically pretty much out of the kindness of their hearts to try to teach you, all right? And they want to teach you, and they want to teach you the best they can. They've got the constraints just as much as you have. So I think it's really important that both teachers and students have a really good understanding and sort of try to be on both sides of the table. You know, I was a student once, I'm a teacher. Your students now, one day, either or both of you might be teachers, right? So you'll see it from different perspectives. And I think that in the world you live in, perspective is everything. Yeah? And we've already touched upon this with social media and everything else. The perspectives you look at stuff. So when I'm saying be present is pause a second and think, you know, this hasn't worked. And it's very easy to start saying, right, we're going to complain, we're going to do X, Y, and Z. When actually stop for a second and think, why do you think that happened? And is there something we could have done to mitigate it? Not blame, not saying either person's right or wrong. Is could there have been some mitigation? Yeah. And we're all adults. So when, you know, I never call students. You know, when we're on clinics and stuff, it's always colleagues. Even a first year or second year is a colleague, right? Because you are. You're a junior colleague, but you're a colleague. Yeah. And I think it's a really important point. Student, you're not at school. You've chosen to go to university, whichever one it is. They're all really, really good. And you've chosen to take that career pathway. That's a big deal. That's a big commitment from you guys. Obviously, the people at university have their commitment to you, but you have a commitment to them. And I think that's all I'm saying is it's a two-way thing. And if that works, then it can work so nicely.
Gotcha. So let's maybe add some perspective to our audience. I mean, why is it that you teach? Why did you choose to teach?
Really enjoy it. I enjoy delivering information to people. I enjoy stimulating and provoking people. I lecture a lot around the world and to postgrads and to other dentists. And one of my disclaimers is that, you know, Cariology can be a bit boring at times, but it's your bread and butter. It's fundamental. And so my comment to people is, you know, if I upset you enough that you feel like you want to walk out of one of my lectures, I don't mind, because I've provoked a reaction. So it's the point about actually having that discussion about taking people out of their comfort zone, getting people to learn about new things. That's something to me I think is inbuilt into people. It's not something you learn. It's in your genes if you want to do that. And then, yes, you can learn the techniques. That's fine. But you've got to have that want in yourself.
Desire to learn, right?
Desire to learn, but also a desire to take that learning and impart it to others.
Yeah. Got you. Two-way thing almost.
Yeah, absolutely.
Understood. So before we get into the nitty-gritty of the conversation, I guess the last point from my end is, you know, we're sponsored by Colgate. You mentioned you've worked with them for many years. What is it you need to do before choosing to work or partner with or even buy from a product or company?
You mean just as a clinician? You mean
how do you do the due diligence?
Well, it's you do due diligence as you would when you're reading papers and looking for academic information. So you will find out about that product. You will ask the company for references about the product, trials that they've done to show the product works, whatever the product is. and also user experiences. So you'll speak to colleagues, etc., etc. You will go on courses. You'll listen to people talk, not about the product in terms of selling it, but in terms of be used in a clinical trial or in a comparative study or something like this. So it's always about assimilating information.
Gosh.
It's too easy to say, oh, this advert's really cool. Oh, I'm going to go and buy that. Oh, they're giving me this at 10% off. Yeah, all right. Obviously, there's an element of that. I'm not denying that. It's life, isn't it? Everybody sort of really wants a deal. If you can get a deal, that's fabulous. But it's still about quality. It's like when you go and buy clothes or trainers and stuff. You know the brands. You know the quality, what they mean. It's no real different when it comes to industry partners.
Got you. So then you mentioned you worked with Colgate for many years. Why Colgate?
Well, it's not just Colgate. I mean, I work with Colgate. I mean, I work with lots and lots of different industry. And I think for me, it's been a very eye-opening experience. So I work very transparently with them, either doing research, doing advisory boards, being key opinion leaders for, lecturing for, etc., but never selling their product. And I think that's the point. Okay. I'm lucky enough that I've done a lot of independent research over the years. So a lot of companies do come asking for my opinions about things or whether we might do studies on their products. So I've had lots of PhD students and master's students and things like this. But ultimately, I am never standing up advertising or promoting a particular product.
I think that's very key as well, because especially now in the digital age, there's a lot of endorsements, there's a lot of areas where clinicians are getting involved with these companies. Is that something to be wary of, to not overstep the boundary of your clinical responsibilities?
I think there's absolutely no harm in clinicians getting involved with industry at all. In fact, I'm a real fan and a big supporter of it, and I'll say that publicly. Absolutely. When I was growing up as a junior academic, we were, academia and industry, never the twain shall meet. Absolutely opposite sides of the spectrum. Now, you can't do research without industry input. All right. And the good quality industry partners will want good quality research. All right. So they go hand in hand, for example. But it's not just research, as I mentioned, it's being a key opinion leader. It's working on strategic advisory boards and helping them to shape the direction of travel. Okay. And, when you're younger, you have less experience at that, but you might well have used a particular product of that particular company, and they may say, oh, you've done loads of cases, would you mind showing some of them and talking about them? As long as you do it transparently and openly, and you don't start saying, oh, this is the best material, and then start taking backhanders and all this sort of nonsense, then what crime has been committed? So you have to be open and transparent and make disclaimers at the outset. And if you do all of that, as I said, no harm is being done. And in fact, it can be a win-win for a lot of people.
Yeah, definitely.
Could you say, Professor Avi, just for our audience out there, one thing you're very much synonymous with is the whole minimally invasive dentistry movement, right? And the fact that you're a big advocate for prevention being more important than cure. To what extent do you think that the population's prevention needs are currently being met?
It's a good question, and it's a $6 million question. And the simple answer to your question is it's not being met. If it was being met, we'd be living in a world where dental decay was on the decline and perio was on the decline. And yeah, exactly. And clearly it's not. The pandemic and the situation there didn't help things at all, clearly, obviously. But we look and we are not, as a profession, we are not getting it right when it comes to prevention. Okay. I repeat, I'm not blaming any individual or any group or anything like that. I said as a profession as a whole, and I'm including all the stakeholders in this. Okay. We're not getting it right. And I'm privileged as I'm getting older to sit on more and more senior sort of national committees or government committees where we're talking about exactly this. And I was at a round table event just before Christmas with industry, with government, and with the profession. And I was listening to what everybody was saying, and he was talking about prevention, and I put my hand up and made the point. It's really interesting when you look at the communications here. If you think about what's the government role in healthcare, all right, I'm taking it right back to basics. The government role in healthcare is actually to give a healthcare messaging, right? 5 a day, eat 5 a day type of thing, all right? When you were much younger, you won't remember in the 1970s, you had people wearing seatbelts, was new. All right, so there was a massive campaign, okay, and things like this. So there's a whole bunch of healthcare campaigns to give health messages. So that's what the government should be doing. Now, not just, but that in terms of communications, that's one of the things they should be doing, right? You can debate whether they are doing that or not. What does industry do to the public? The industry sells. It's there to sell. Whether it's product, concept, whatever it might be, they're there to sell. So government is there to give the right messaging. Industry is there to sell. And what does the profession do? At the moment, and what it has been doing forever, is it lectures. What am I doing to you guys now? That's what it sounds like, doesn't it? I'm not trying to lecture you. Of course I'm not. We're having a conversation. And we will say we never lecture to our patients and things. Yes, we do. Because ultimately we're saying, you know what, if you don't brush your teeth, you know what's going to happen, don't you? You're going to get pain, you're going to get holes, you're going to get bad breath, it's going to get bad appearance and blah, 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 right? And all of dentistry is always shown with negative connotations. Toothpaste manufacturers, for example, how do they sell toothbrushes and toothpaste? When you watch TV, when you're online and you see adverts, how do they sell them to you?
Bright smiles, good teeth.
Right, so what they're doing, they're selling a lifestyle. They're not selling toothbrushes and toothpaste, right? What are we doing when we've got a patient in the chair?
They're selling ABC solution, right? A point in time.
There you go. And actually we're pinpointing something that's negative. And where are we doing it? We're doing it in surgery. Do you think a surgeon starts giving preventive advice on the operating table?
No.
What are we doing? Now, I repeat, it's someone's fault. But the system isn't quite right, which is why you'll see now more and more sort of dental practices with simple surgeries. You've got people who are being much more business orientated and producing spa boutiques and dental boutiques and things like this. The reason for that isn't the cosmetic bit. In fact, it's nothing to do with that. It's the fact that you're going into a feel good space. So you're playing with psychology. All right. When you're going to talk about prevention, you don't do it in a cold clinical surgery with dental chairs and drills and x-ray machines and stuff. You do it in a nice comfy room with plants and some fish floating around, not floating, swimming around in a tank, and they can have their nice herbal tea. You know what I mean? That's the point. We're getting that wrong. And one, depending on where you go to be taught, at King's, for example, we have a very strong behavioral psychology unit, and a lot of our curriculum is based around exactly this. It's how you message things to patients and their caregivers and everybody else. And it's not easy. And we always call these the soft skills. They're not soft skills. They're the hardest skills, actually, especially in the world we live in. So it's tapping into that is vitally important. It's undervalued in the profession. It's undervalued by stakeholders and policymakers in terms of remuneration. All right. And because of that, it makes it very, very difficult for clinical teams, oral healthcare teams, to carry this out in primary care. Yeah. And so people like myself and many others have been challenging this for several years now. And the worm is turning ever so slowly. And which is why it's too simplistic to say, oh, it's too difficult to do. And nonsense, because ultimately healthcare is not sustainable unless it's prevention based. It's got to be prevention based. It's got to be susceptibility related, right? Risk susceptibility related. Okay. It's got to be team delivered. Can't be just one person. Can't be a dentist. All right. And it's got to be, as we said, it's prevention focused. And if you take those four aspects, those four pillars, those four domains, you basically have minimum intervention oral care, which is what you're all being taught. All right. And that is the care delivery framework. And it's common sense. It's what I was taught, but we didn't call it those titles. But if we get the title and the terminology right, it then allows people like myself and others to go to governments, go to industry, go to patient groups, go to public, go to all the stakeholders and say, actually, we're all saying the same thing.
Under one uniform package in a way, right? Yeah. Well, so Avi, you kind of mentioned there how, Professor Avi, sorry, you mentioned there how, industry have a commercial incentive, a financial incentive. Government should be there to message and transmit communication. You mentioned the dentists right now are lecturers. What would you say they should be then? What would you?
Well, as I said, I was making a general statement. Clearly, I'm not suggesting every clinician is lecturing. I didn't mean it that way. That is metaphorically. We're sort of telling even though behavioral psychology is when you have to facilitate, you have to encourage, you're not just telling people, but actually when push comes to shove, that's what patients feel, generally speaking, right? So that's what needs to change. And I know, for example, at King's, we're working really hard with our undergraduate curriculum to really get students and the teams working with patients to really work like that. And I'm sure you're at Manchester, right? They're doing the same, and as are many of the other dental schools. So there is a big push towards that. I think one of the difficulties is, and it goes back to your question earlier about the gap from dental school to practice, is that when you graduate, you suddenly go from the relative safety and comfort of your dental school and your clinics and your teachers and your profs and everybody else to suddenly having to be out there in the big wide world on your own with patients, and you're probably now suddenly seeing 15, 20 patients a day, maybe more, as opposed to 3 or 4 a day. And you're suddenly thinking, ooh, this is a little bit more tricky. And I've also got to make sure that the nurses looked after, and I've got to make sure that the sterilization room shuts on time, and I've got to make sure the equipment's looked, and so on and so forth. And these things all build up, and then the easy things to drop away and to leave to one side are these sorts of soft skills, as we mentioned, and depending on who's training you when you're in practice, the risk is you then get back onto a treadmill, onto a conveyor belt of saying, well, I've got to do lots of fillings, or I've got to do lots of crowns, or I've got, and that is important. No one is saying it's not. And minimally invasive dentistry is one part of that minimum intervention oral care framework. It's just one part. That's a part of it. Fabulous. But you've got the other domains as well. And it's critical that you don't lose sight of that. It's easy for me to say, oh, you must do prevention and that's it. But clearly, if you're not being remunerated properly for it, you need to work it. You need to be clever. So then you start using your team members. You can train dental nurses to become oral health educators. You can train your dental hygienists, dental therapists. These guys can often deliver a lot of that. All right. So earlier you were talking about business models and things like this. Business models isn't about just how much money can I make. Business model means you're also employing staff. You're also being a leader. You are mentoring people. You are encouraging people to, move forward in their own careers as well as your own. That's the beauty of dentistry, that in one profession, you get to be able to do all these different things. Medics can't do that. Think about it. Medics can't do it. Think about it. What a general practitioner, medical student, I'm sure you've got medical student friends. They graduate. They never see a patient. In terms, they're never responsible for a patient. By end of year 2, you're responsible for your patient. All right. You're wielding instruments inside their mouths. All right. You can do harm. You can do good. A medical student doesn't have that control because the doctors look after the patients. Right. So that's why they have a vocational training scheme. But when they go out into general practice, they're looking after their patients in a totally different business model. You don't, you have to learn so much more as a clinical dentist. It's chalk and cheese. It's chalk and cheese. And I always said it. I've been teaching 30 years, and I've always said dentistry is a much harder undergraduate course than medicine, and I will stick by that. Because you have to be a master of so many things. Not just academic, not just clinical, but everything else, which as a medical student at that stage you don't. You learn those things afterwards. That's the difference.
Understood. Awesome. So, Professor, let's go on to know what you're most well known for. Around the world, you've spoken on many stages. But this topic right here, minimally invasive dentistry.
Absolutely.
Talk us through this textbook, Professor. How did this go about?
So, you guys, you may have heard of Pickard's guide, right? So that's a very long-standing traditional conservative dentistry textbook from the UK that most, if not all, dental schools have been using since the 1960s. I was very privileged to get onto the authorship for the just get it right, the 9th and the 10th editions. So that was around 2010 and then 2015. great textbook written by some amazing stalwarts in the field. And as COVID came around 2020, 2021, I wrote to the publishers and said we need to get the next edition sorted out. When I found out that that current publisher was stopping publishing that textbook, they decided to move out of publishing dental and medical textbooks, or at least dental textbooks. So after a lot of toing and froing, I still felt that a new edition of Pickard's needed to be written, because it was 7 years old, so things have moved on. And so I took the sort of manuscript I had and went to a different publisher, to Elsevier, who you can see for this book, and they snapped it up. But the copyright of the title is owned by the previous publisher, so he couldn't use Pickard's, which is a real shame. So this book, even though it's a new book, it's a year old, it's a first edition, but it's actually the 11th edition of that series. And that's the way of thinking of it. So it takes you through the whole of the minimum intervention oral care framework. And it will walk you, dental nurses, dental hygienists, dental therapists, it's there for the whole team. And it will walk you through from academic knowledge about histology of caries and tooth wear and tooth structure, right the way through to clinical detection, diagnosis, care planning, prevention of lesions, control of disease, then a whole range of minimally invasive operative treatments, materials, operating technologies, right the way through to then recall, reassessment, active surveillance, how you look after the tooth restoration complex. And even at the end, I've put in now some stuff more specific to the UK and the NHS with care pathways showing the potential remuneration of different procedures, including prevention, which is some work I've been doing with the Office of the Chief Dental Officer for 2 years. So that work has been published, and that now is being put in front of NHS England, whilst it still exists, to then look at to see how we can transform a little bit the way we remunerate treatment on the NHS. I'm not saying it's all fixed just like that, but it's a starting point. So that book is the manual, if you like, for the whole thing. And obviously references, and it's all in there. It's a very thin paper, so it's a very thin book, but there's every word counts in that book. Yeah. Every word counts.
Yeah. What's the importance of a dental student learning something like this on the ability to give the best possible care to patients?
Well, you've just basically said it. That was a statement, not a question. You're right. That is best clinical practice. It's as simple as that. Minimum intervention oral care, MIOC, MEOC, is best clinical practice. It's what I was taught. It's what everybody was taught, maybe with slightly different labels, right? It is common sense. But it's been structured in such a way to allow you guys and anybody reading it and anybody talking about it and anybody paying for it to actually start to look at it in little sections rather than just one big sort of, list. So it also, as I said, then weaves in the team, which is vitally, vitally, vitally important. A dentist can't work by themselves. Anybody who thinks that has got it wrong. You need the teamwork around you. So if you look at all these things, this is obviously it's only a year old, so it's very contemporaneous. I'm pleased to note that the reprint, it's already gone through its first print edition, so hopefully there'll be not hopefully, absolutely definitely will be more being printed. And it is the basic spine, the backbone of your undergraduate curriculum, and actually it will take you into the early stages of postgraduate. So we have something called the College of General Dentistry that's out there now, as I'm sure you're aware, CG Dent. So I'm the faculty chair of the College of General Dentistry as well, which I didn't mention at the beginning. And that's looking at career pathways. So you guys graduate, where do you go next? Right? In terms of your career pathways. Now, classically, we're going to specialize, but that's not a career. That's just going to do dentistry in a different system. Right? A career pathway is what you do. You're going to get more degrees. What are you going to do with them? And so we're looking at this for primary care, not for specialisms, right? But for primary care. And a book like this, the content of which will start to take you from being a safe practitioner to an accomplished practitioner and so on. So I was very keen when I wrote this edition, because I'm the sole author now. And if you think of this as the as Pickard's 11th edition in inverted commas. I'm not allowed to say that publicly. I think Oxford University Press will tell me off for that. But essentially, that's what it is. This gives you the bread and butter of what you need. Obviously, you're going to read other things on top of it, as we said a few minutes ago, right? You'll sprinkle that with guideline papers and other key things, delivering better oral health version 4 and all these key documents, right? But if you just read those few things in conservative dentistry, conservative MI dentistry, you're sorted. You will know everything, and you'll know it to a good standard and contemporaneously.
Very interesting. So, Professor, can you give us maybe a fresh perspective on this textbook and not make you forget how much work went into actually writing this up and kind of coming out with the quote-unquote 11th edition?
Yeah, so it's a lot of work. I mean, you write books, or academic books at least, textbooks. It's a labour of love. It's not it's not a money maker or anything. It's certainly not for the author. It might be for the publisher, but not for the author. And it takes a huge amount of work. Now, I'm sole author, but within that book, there are many people who contributed fantastic clinical cases and images and things like this, and they're all obviously duly acknowledged in there. I also edit Odell's Clinical Problem Solving in Dentistry, and there's going to be a 5th edition coming out of that, so I'm just finishing editing that at the moment. Now, that's editing. So there, authors will write different sections, different chapters, and then my role with a colleague is to sort of start to pull that together into a sort of a consistent sort of framework. So when you read it, it sort of flows, because it's a different type of thing. This was my words, and because I'd written 2 other editions, previous editions of a similar book, it to me, the storyline is quite straightforward. And because it's based on minimum intervention oral care, again, it just flows. It goes section by section by section by section. And because it's written, as we were just joking about it, that it is quite thin, every word does count. So if you look in there, you don't have to read swathes and swathes of text. The most text you'll ever have to read is probably 1 page, because the rest of it is tables, flowcharts, bullet point lists. There's self questions in there to sort of test you. And there are 1 or 2 the sort of references and guide points for you to then go online and check out further information. But on its own, it's pretty comprehensive.
Yeah. Well, when it comes to generally academic writing, then, because we touched upon that, I mean, having written so many peer-reviewed articles and papers, etc., I mean, you can mention the exact number. What are some lessons or reflections that you learned from that?
Well, the first reflection was my first paper I wrote, my first peer-reviewed scientific paper I wrote in my 3rd year at dental school. Right, so I was a year above you. And I was at Guy's at the time, and I had a fantastic teacher at the time. He was Dr. Watson. He's now Professor Watson. He's retired now, or semi-retired. And he was doing material science, and I got really involved. And I remember in year 3 in those days, and I'm just reminiscing back now, we used to do med-surg, we used to call it, medicine and surgery in year 3. So those were the exams. And I remember going in to his labs on a weekend to look at samples and things like this. We were looking at coating glass ionomers. All right. So, you place glass ionomers in teeth. Nowadays, the modern glass ionomers, you're meant to use a resin coating over the top. Well, in 1993, I published my first paper on that subject, and it took industry nearly 30 years to actually make the product, which is quite interesting. But I learnt so much from him. And in those days, you didn't have courses. There was nothing online. You could go and look. You read other papers and learnt from what you read and saw format and how people wrote. And then you had your mentors and teachers to sort of hold your hand and do it. All those years later, I've now supervised 50 PhD students and master's students together, and they're all writing papers and dissertations and theses and everything else. And you look at the tech, even now, everything's sent obviously on computers and with word processing software, and now it'll be AI and everything else. In my good old days, I would print pages out, give them to my supervisors. A week later, they'd come back in an envelope with red pen all over them. Very old school. So, as I said, I learnt by osmosis. All right. You guys now, there's hundreds of resources, if not thousands of resources out there of people explaining in nice short little podcasts and things like this, how to write. At the part of the British Dental Journal portfolio, we run courses for young clinicians, not just dentists, for dental hygienists, dental therapists, dental nurses, etc., to teach them or advise them how to write. And of course, in the portfolio, we have 6 journals, but we have BDJ in practice, we have BDJ team, we have BDJ student, where students can actually start to learn to write papers. And in fact, in this year, we're actually we're doing something a bit different, where each university is basically hijacking, in inverted commas, an issue. So that issue is written all by students from that university. Okay, so I think we've done 2 so far. It's King's, I think it's Cardiff, if I may be mistaken, but I think it was. So, and they're really good. They're really successful, and the articles are so well written. So you guys have the skills, all right? So don't. Again, it's what I said earlier. Be present and keep trying. Keep trying. You've all got the skills. It's whether you want to do it or not, whether you want to apply your time. That's up to you.
Yeah, I was actually going to ask you what were the best ways for students to actually get into academic writing, but you just mentioned.
There you go, and that's what and speak to your teachers. So if you can get it, I went up to my senior lecturer at the time, back in all those years ago, back in the early 90s, and I said, I really want to get involved with research. He knew I was a keen student. I was there. I was present. All the things I told you about. So he said, fine, right, I'll come and I'll teach you in the lab. All right. The world's changed now. Life isn't quite so simple. We know that. But the principles are the same. If I have keen students coming up to me saying, Prof, I want to get involved with research, or I want to get involved with this, or I want to get involved with that, you will never get turned away. You will never get turned away. But you've also got to be realistic. These things take energy, time, and effort. And there's lots of people who'll think they want to do it. Oh, yeah, I'd love to get involved. And then when suddenly they realise they've got to put hours in, then suddenly they disappear.
What is that dark side of academic writing?
Well, the dark side, I suppose the dark side is it's hard work. These things are not easy to do. Writing papers isn't easy. Doing research isn't easy. Teaching isn't easy. All right. To do these things properly takes a huge amount of skill, innate skill. And I know, again, people go off on courses and you can go on training and everything else. That's fabulous. I'm old school, and I believe to be genuinely good at these things, there's got to be something intrinsic built in. Right? To say that, you can go and, train and learn to be a gymnast or an athlete is nonsense. You need the physiology, right? And then you need the training. But if you don't have the physiology, you ain't going to be Usain Bolt, right? I can't go and run 100 meters in 9.6 seconds, okay? Never. I can train all my life, and I might be able to do it in 10.8, 11 seconds if I trained really, 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 really hard and spent all my life doing it, okay? So my point I'm trying to get at is you need to have an intrinsic, there's got to be something inbuilt. Yeah, and therefore for you to find that out is you need to try. But if you're going to try, it's not like I'm just going to dip my toe in and, oh, no, that's it. You actually have to get immersed. You may not like it for 6 months or a year. But as I said earlier, we talked about what does succeed, what's the definition of success. I would argue trying something properly, and then realizing, do you know what, this isn't for me. That's success. Because that's valuable to you. Dipping your toe in for 5 minutes, which unfortunately the modern sort of social media culture is a little bit like that. I can do a bit of that, I can do a bit of that, means nothing. But actually doing it for a period of time, get immersed. If it works and you're loving it, then fabulous. You've got a skill, boom, you crack on. If not, you go, okay, fair enough. Wasn't for me, but at least I know, and I know why. Do you see? And so you've learned something.
I see. That will give you the last question to round of the discussion. What does success look like to you? And is that your answer then?
I think it is. I think success looks, honestly, it's coloured in whichever colour you wish it to be. And anybody who's defining it, I think, unless, or you can argue success is passing exams if you want to be tangible about something. But that's a really small, minor little point. It's a point. But you're going to have so many other things in your life, That's one of them. Clearly, you've gone to a course where you will be assessed and you have to pass assessments, right? That's part of life. So you could argue that's success. But is it? That's just the beginning. And I would argue actually success will be getting honours or getting a distinction or doing even more, because that's real success. But then counter of that, as I just said, negative experiences can also be success. And I would argue should be counted as success. You don't want too many negatives all the time, obviously. But the point is, if you're really doing something, you think, do you know what? This didn't work out for me, because that should be, in your own mind, in your own heart, that should be also a sign of success.
There you are, guys. Young Dentist Season 2. I've been Afif.
I've been Fahim.
We have Professor Banerjee's amazing guest here. Thank you very much.
Thank you. Thank you so much.